morning, my name is Erin. I want to try to practice about job interview as an English project assessment. Okay, good morning. Today I want to know you better. Please tell me about yourself. My name is Erin, a graduate from Tasikmalaya College of Nursing. I like to interact with others and have high concern about helping people in need. I ever practiced in hospital and public health center about basic of nursing, surgical medical nursing, maternity nursing, child nursing, mental nursing, and community nursing. I have a lot of experience when I practice in hospital and public health center, especially about interact with others. Moreover, I am active in campus organization and I always be a volunteer in every organization activity like PKG or Free Heart Check, Integrated Health Care Center, and the other. What do you know about our institution? I know this hospital started as a hospital that only handled neurosurgery, but as time went on, this hospital became a public hospital due to soaring patients. Besides, this hospital facilities also keep developing and improving along with the needs of patient care until now. The vision is to expand service in the field of maternal and childhood service and reduce the risk of maternal and newborn mortality in the surrounding area. Meanwhile, this hospital mission is to provide convenient, safe, fast, precise, and friendly service. Why did you decide on a career as a nurse? I come from an entrepreneur family, but my aunt is midwife and pharmacy. I see my aunt every day, and sometimes I want to know how my aunts do her work and how my aunts really love to her work. They keep me excited and engaged in the whole sector. I want to be a nurse because I want to be different from my other family and can share different knowledge and abilities with the family and community. I am proud to be someone who contributes to the health field and can be useful for myself and others. Tell me what you feel your greatest skill as a nurse is. I am very proud of my ability to can easily affect a patient. I looked at my ability from my experience in a hospital or public health center. Affect a patient very necessary when I'm going to do a nursing care. I'm proud myself for my ability because that is make patient believe to the nurse and client feel comfortable with my nursing care. How do you handle the stress of the job? I find the best way to handle the stress of the job is make a scale priority and make a note in my diary book about the problem that I feel, with listen to music in my room. Moreover, I will eat my favorite food, then I try to find a solution to this problem, and I do that from my experience in school. What do you find is the hardest part about being a nurse? I think a harder thing about being a nurse is when the patient can be invited to work together with a nurse accompanied by courses. When this problem happens, the nurse should still to keep smile to the patient and must be patient, even though sometimes the mistake occurs at the behest of his own patient. Why do you want to work here? I am interested to work here because the service at this hospital is very outstanding. According to the experience that I have at this hospital, the health staff were professional and could make patients feel comfortable. The facilities in this hospital are very adequate, complete, and quick response. Therefore, I want to be a part of such health workers in this hospital. Are you comfortable working with others doctor and nurse? I can work with other doctors and nurses because I like to work in teams and enjoy discussion. Besides that, I have a high curiosity to work and I am the type of person can work with the other people or the other profession and I am the type of person who enjoy learning something new. According to my experience in hospital, I ever working with doctors regarding visit to patient and I ever work with the other nurse regarding my nursing care for the patient. Describe a time you had to deal with a difficult patient and how you handled it. For my experience, I ever find the patient who can invited work together with nurse and complain about the service provided. In this problem, I feel very alright. But when I find the type of the patient, the most important thing is we have to ask the patient complaints about the service provided. After that, we can find out what problem arises and we can discuss with the patient about the problem and explain in detail to the patient until the patient understands. After that, the patient will be easier to work together with a nurse. Why should we hear you? Although I am a fresh graduate from nursing school, but I have a lot of experience and other capabilities. I make sure I will become a nurse who continues to learn from experience and her abilities seriously, and I can provide the best service.
Is your tattoos or golden grill that makes me feel